Many girls and women get it at some stage in their lives, but it can be difficult to talk about it. Painful periods are very common and can usually be effectively treated. But for some women, the pain is so severe that it can disrupt their lives. Now, a study by period care brand Blood found that almost half of the women surveyed admit to regularly taking time off work to deal with period pain, or to avoid the awkwardness in the office during that time of the month. More than 1 in 2 have admitted to lying about their reason for absence to avoid ridicule or discrimination at the workplace. And 71% said they feel pressured to be at their desk even though they are unable to perform to the expected standard due to period pain during the first few days of their cycle. Earlier, I spoke to Dr. Liana Koe, an obstetrician and gynaecologist at STO+G, Laparoscopy and Fertility practice. I asked her what are the causes of period pain and why do some women have more pain than others.
Okay, so the most common reasons for period pains, gynae-wise, would be fibroids. Fibroids are basically growths in the muscle of the womb that can cause contractions and more pain during the menses. There's also ovarian cysts, so these are growths in the ovary that can also increase period pains. And lastly, there's also a condition that's quite common called endometrosis. This is actually a condition that's getting more and more awareness now. And it's a condition where the menstrual cells, when they backflow through the fallopian tubes, it actually causes a lot of scarring, a lot of inflammation around the pelvis, which is the area around the womb and the ovaries. And this results in even more pain that can be actually quite excruciating for many women. So I would say these are the 3 most common reasons I see. There's also one where the muscle of the womb is a bit thicker than usual, and that's known as adenomyosis. But essentially, in order to differentiate between these conditions, you would need to see a gynae in order to do a scan and evaluation.
So, what are some effective ways to relieve period pain, and can improving your diet help?
So unfortunately, diet is a very hard thing to do research on because there are so many variations. But there are some studies to show that women who lack calcium as well as vitamin D do tend to have a bit more period pains. So I would say, I do tell my patients, there's no harm in taking a diet rich in calcium and vitamin D. This includes dairy products, milk, cheese. Vitamin D is found in things like green leafy vegetables, spinach, tofu. So all these would be good to maintain a healthy diet.
Doctor, women shouldn't have to struggle with period pain every month, but are there certain symptoms that require immediate attention?
So I would say a lot of us do suffer with period pains. If they are bearable, meaning they do not need any pain relief, painkillers, that can probably be just observed. But if you do have pain that is affecting your life, you need to take medical leave once a month, or you need strong painkillers, you need to see a doctor for prescription. Worst case scenario, even see an emergency department for medications, then definitely you would need to see a gynecologist to exclude the following conditions that I did talk about.
Doctor, thank you so much for your sharing. Dr. Liana Koe from the STO+G Laparoscopy and Fertility practice. For more on the topic of period pain, we have stories of women in Singapore speaking candidly about it. Have a look online at str.sg/livingwell.